Exactly, yeah, and
Yeah.
that's my point. So if you take another viewpoint, which is the patient's viewpoint, where I just want to be better, right? I want
Hmm.
to have less
Hmm.
pain. Those who have been in a control group and got the placebo lived a better life at the time they were doing the trial, right? Because their pain was reduced. So maybe this is what is important.
And so, what kinds of studies are you guys doing now or doing next that are related to this work?
So related to this work, we want to understand how it works. So how this pathway is able to reduce pain. So we're looking at the cerebellum, how the cerebellum is connected to the rest of the brain. This is the placebo effect. We're also quite interested in the opposite, which is known as the nocebo effect, where some subjects can develop something that's called as pain catastrophizing, where pain is perceived as worse than it should be based on the injury or the disease or the actual stimulus. We have some so we were just talking about subjectivity and inter-individual differences. We have primary studies where if we start, for example, with 10 mice, and we will briefly expose to the hard floor every day, right? So that they get used to it. And so that, these are the two things: placebo, nocebo, how we make decisions. This is a part of pain that's, at least in terms of basic science and, cellular molecular mechanism, is a little bit understudied compared to all the work that's been done in the peripheral nervous system.
Well, this has been fascinating, Gregory. Very interesting stuff. Is there anything you want to reiterate that we discussed, or any sort of final thoughts you want to leave people with that has to do with pain and pain perception and how we experience pain?
Maybe pain treatment, because I think that's, with the opioid epidemic and many, many people being in pain, this is really a priority. Maybe this notion that ideally we want to have, as many new painkillers as possible. So some that work in the periphery, but I think it's really important to study these other aspects of pain, the emotional aspect of pain, the cognitive aspect of pain, so that we have different treatment options and ideally things that we can combine. If you think about other fields of medicine,